Hello everyone, we are going to present assignment 6 in this video. Here is the questions. A 44 years old man with history of alcoholism and chronic abdominal pain presented with lost weight, diarrhea, and passing greasy foul-smelling stools, which were difficult to flush. His abdominal pain was localized to the mid-back and associated with meals. Biochemical testing were performed and is shown as below. Question 1. Interpret the above result. The keywords in this case are history of alcoholism, chronic abdominal pain presented with lost weight, diarrhea, greasy foul-smelling stools which were difficult to flush, abdominal pain which is localized to the mid-back. The test result is shown as below. Hyperamylasemia shows the high level of amylase in the serum. Hypocalcemia shows the low level of calcium in the serum. Hypoalbuminemia shows the low level of albumin in the serum. Hyperglycemia shows the high level of glucose in the serum. Bilirubin is at the borderline of the normal range. ALP level is high in serum. GGT level is extremely high in serum, while ALT, urea, and creatinine is show normal range in the serum.
So for question 2, he is asking what is the possible diagnosis. Explain your answer based on the above information. So we diagnose the patient is having the chronic pancreatitis. Pancreas is a large gland behind the stomach and is next to the small intestines. It functions to release powerful digestive enzymes into small intestines to aid the digestion of food and release hormones insulin and glucagon, which aid in the regulations of glucose. Chronic pancreatitis is a long-lasting inflammation of the pancreas. It can be caused by heavy alcoholism, which can be seen in the patients. So we diagnose the patients having the chronic pancreatitis because the typical symptoms for the chronic pancreatitis also can be seen in the patients, for example like abdominal pain at the mid-back, often was 15 to 30 minutes after the meal. Diarrhea results from the fat malabsorption, which lead to the greasy foul-smelling stools, as well as a weight loss caused by the malabsorption due to the less secretions of the digestive enzymes. Moving on to question 3, explain why this patient had hypocalcemia and hyperglycemia. Hypocalcemia refers to the calcium level which is lower than the normal range, which is 2.1 to 2.6 millimole per liter. In the body, half of the total calcium is in the ionized forms and the remaining calcium is bound to the albumin. Albumin acts as a carrier protein for the calcium, thus, as the patient having the hypoalbuminemia leading to the less transport of the calcium, resulting in the reductions in the total serum calcium. Besides, sequestrations of the calcium by sulfonifications in areas of fat necrosis also cause the hypocalcemia. This is because in the fat necrosis, enzyme lipase release fatty acid from triglyceride and the fatty acid is then complexed with the calcium to form soaps, which also refer to the white chalky deposit. Hyperglycemia refers to the blood glucose level that is higher than the normal range. Normal range is usually lower than 11.1 millimole per liter. Chronic pancreatitis affects the endocrine functions of the pancreas, which is responsible for the insulin and glucagon productions. Thus, it can be said that the patient having the hyperglycemia is due to the inadequate secretions or utilization of insulin, which is induced by chronic pancreatitis. For question 4, explain why this patient passed greasy foul-smelling stools, which were difficult to flush. Pancreas helps to digest food by secreting lipase to break down of the lipid, protease to break down of the protein, and amylase to break down of the carbohydrate. Pancreas of the patients with chronic pancreatitis may not function normally, leading in difficulty to process fat in the diet due to the lack of lipase, thus resulting in greasy foul-smelling stools that were difficult to flush.
Question 5. What other possible micronutrients deficiency he might experience? The patient might experience deficiency in magnesium, calcium, zinc, and selenium. Here are the references for our assignments. Our presentation ends here. Thank you for your watching.